Hi, this is Dr. Michael Ryan with Missouri Vein Care talking about what is red and brown discoloration on the skin in your lower legs and ankles. Well, in my experience as a vein care practitioner, it's very common to see this as a result of vein circulation abnormalities. The vein circulation in the legs becomes abnormal, and there is blood pooling in the legs, which is another name for chronic venous insufficiency. The circulation is under pressure and the blood is not flowing, and the body has a reaction to that, which is an inflammation reaction. When the blood is not flowing, it's stagnant, and this inflammation reaction is generated. And so inflammation has a very characteristic appearance. Usually it's associated with a red discoloration. As the inflammation progresses, the skin can also get quite tough and thick and hard, and that's because the skin is actually forming scar tissue, because inflammation anywhere in the body will result in scar tissue. And that's a healing response actually, but in this case it's not really healing something, it's abnormal. So the red discoloration typically in people with blood pooling in their legs or vein insufficiency is in the inner lower calf or ankle area. That is also an area where you see brown discoloration. The area overlaps, and that's related to this abnormal circulation under the skin. The brown discoloration is there for a slightly different reason. The red discoloration is because of inflammation, which by the way can also be associated with a lot of itching. It's a sign of inflammation. But the brown discoloration is because the circulation is under pressure, and the red blood cells inside leak out into the tissues, and then there are certain cells called macrophages that are responsible for protecting the tissues from any foreign material. And as the red blood cells break down, hemoglobin inside the red blood cells, which is the molecule that carries oxygen, is then consumed by these cells called macrophages, and they actually are permanent cells, and they create a brown stain or tattoo that's permanent. So once that brown stain is there, it doesn't usually go away. Occasionally it can improve or lighten up, but it won't go away. The best treatment is to catch it before it advances, and it will advance. Once it starts along that pathway, it will advance. So this is Dr. Michael Ryan talking about red and brown skin discoloration of the leg.